George. Thank you all. Let me start on this happy occasion with a sad story. But it's a sad story I've told before, and unfortunately it bears repeating. 2 Labor Days ago, there was a man named Dolores McClendon who lived with his grandmother, and the situation was bad because he was suffering from paranoid delusions, and she called for help and got it, and he got some treatment. And then the next day, August 31st, he had another bad day, and he got some more treatment. And then on Labor Day itself, Dolores was in worse shape, and he took what appeared to be a handgun, it was actually a pellet gun, went out onto Interstate 84 as people streamed back from the gorge in Labor Day traffic and caused a massive public safety incident. It included 86 police officers, basically everyone on duty that day, responding. Our CERT team responded, and unfortunately he was wounded and taken into custody. That's not good treatment for someone in a mental health crisis. And the Portland Police Bureau is doing such a good job of de-escalating most of these crises. And I want to praise that good work. There are people here involved in that work, in our behavioral health unit, and in our partnerships with you as providers. Every single day I get a page on this phone about brilliant work by our police officers using the new training that they're getting and de-escalating a mental health crisis. But that's still an insufficient response. That's a medical crisis getting a police response. And that's why this facility is so important. Yes, I have been an enthusiastic backer of this amazing public-private venture. But your leadership, Dr. Brown, and the rest of this team is why we're here. So thank you for being leaders with a great idea. And our job as community leaders, Chair Kafori and I and others, is to be effective partners with you, not only in getting the building done, but making sure that everything else links to it. More humane police work, housing options for people that need supportive housing as they are discharged from this facility and their care moves on from on-site to off-site. We need to make sure there really is a continuum of care for these folks. But first we start with the building itself, and that's why we're here today, and it is so exciting. I'm a guy that has to deal with the growth and development of our city. In fact, I'll spend the afternoon and this evening on the first of our hearings on our comprehensive plan for the next 20 years of our city's growth. And you look around, there's a lot of construction going on. But it's not hyperbole for me to say this. This is the most important construction project in the history of our city. This is the most important one. We build lots of buildings, and they do good things. They house people, they're office buildings, but this is different. This is a new model. And I'll close with this. President Lincoln, at a time of crisis, not this kind, but a crisis nevertheless, said something that applies to this. And he said, as our case is new, so we must think anew and act anew, and then we will save our country. So it is with us. As our case is new, so we must think anew and act anew, and then we will save our fellow citizens, and that's what this building will do. Thank you for giving those of us in public service an opportunity to do a better job of serving the most vulnerable people in our community. Thank you very much.